Have you heard the saying that muscle doesn't grow in the gym? This is the idea that exercise is basically pointless unless you have adequate rest, recovery, and nutrition. Now, this goes doubly when you're fighting cancer, since it may increase your metabolic rate and drain your energy levels. Stick around for the different mood, sleep, and pain optimizing strategies I give my patients so they can fight their hardest again tomorrow. My name is Dr. Alex Watson, and I get people ready. I'm a double board certified physician in physical medicine, rehabilitation, and obesity medicine. I take this expertise in metabolic and rehab medicine, and I help patients get ready for major medical procedures. In this series, I'm sharing my best insights for prehabilitation before cancer therapies. I'm also giving away the cancer prehab chapter of my book for free down below. My only minor request is that you give this video a thumbs up and subscribe so you can see when the next video in the series is released. Don't worry, they are all filmed. This is not going to be one of those channels I can't finish what I get started. This is part 6 of a full series on cancer prehabilitation. In the first ones, we went through the basic prehab program structures, my different plans of attack based on different cancer types, plus a recent deep dive into the exercise pillar of cancer prehabilitation. Check out those after we now talk about the different physically and mentally restorative properties of this pillar of cancer prehabilitation.
For nutritional optimization, approaches vary, but I still look at the cancer prehabilitation population as I do my normal population of patients. In this case, you want to focus on things that are going to support building muscle mass while losing weight. Most individuals in this country are going to have the issue with relatively low muscle mass and higher body fat percentages than would be ideal for optimizing metabolic health before cancer therapies. For these reasons, the approach is going to be to maintain muscle mass often at the expense of not maximizing weight loss. Because with cancer therapies, a big predictor of better outcomes here is going to be maintaining body weight at a fairly steady state. Large weight gain or large weight loss tends to have worse outcomes, often because the weight gain suggests metabolic health is changing, and the weight loss suggests they're going to lose some muscle mass in the process. In the general population, I may be willing to sacrifice a little bit of muscle mass if it means we're losing weight faster just to get a better health outcome sooner. But when it comes to cancer prehabilitation, that is not a trade-off I'm willing to make. Now, other nutritional factors that we want to consider here are going to be different supplements that may be beneficial. In this case, whey protein or other protein supplements are really important to make sure you're getting enough protein throughout the day. And then as far as other supplements, creatine monohydrate is a great one that is safe for everybody in terms of potentially supporting muscle mass and improving your outcomes from exercise. Back to nutrition now. So, everything starts with a nutritional assessment. You want to try and identify any sort of signs of malnutrition to begin with, as this is going to be important for treating ahead of time to get the most out of prehab and also minimize any sort of complications during treatment. When it comes to a baseline nutritional assessment, it begins with body weight and body composition often, as any sort of signs of low muscle mass is going to imply a greater need for protein. So these signs of malnutrition are going to be first related to weight loss. Any sort of unintentional weight loss of about 5% over 3 months or 10% over 6 months tends to imply that your calories are not quite adequate to meet the needs of your metabolic state presently. Other signs are going to be weakness. New weakness in particular can be evident in hand grip or any sort of difficulty in performing your activities of daily living. Things like getting out of a chair, carrying groceries, carrying laundry. If suddenly you're finding yourself much weaker in the context of weight loss, that would suggest losing some muscle mass, and that strategy should probably need a little bit of a tweak there. Not to harp on protein, but it's extremely important. So nutritional guidelines for patients fighting cancer suggest you need about 1.2 to 2 grams per kilogram of body weight a day. To make this nice and easy, I usually just say get 1 gram per pound. So for somebody whose ideal body weight is around 150 pounds, that's going to suggest 150 grams of protein is your goal for the day. So divide that as evenly as possible and spread it throughout the day. In this case, you might become best friends with scrambled eggs in the morning, as I am. In many cases, though, it's really difficult to get the amount of protein that you need just from food sources alone. I carry a whey protein container pretty much everywhere I go, just in case the protein access might be limited to wherever I'm going. Sources like whey protein, casein, egg, pea, most plant proteins are likely going to be meeting your nutritional requirements. Ideally, you want to have that protein be as complete as possible, and complete proteins are going to involve higher amounts of BCAAs like leucine or lysine, high proportion of other important amino acids like methionine, as these are really critical in stimulating muscle building and muscle maintenance. When it comes to choosing a supplement, you want to pick it early. So before you have any sort of changes in taste due to chemotherapy or any other treatment-related impacts, I like to stick with something along the lines of an Ensure Max or other high-protein, low-sugar sources of protein supplements. Premier makes another good one. Optimum Nutrition, GNC brand. I have no skin in the game here. Just pick one, find it early before your tastes change, and then have a few backup plans along the way too, just in case. Last piece about nutrition I want to cover today is going to be ketogenic diets. There's a lot of buzz about ketogenic diets and the potential for benefits, especially during cancer treatments. A lot of this stems from two concepts, one of which is something called the Warburg effect. So the Warburg effect is a finding that cancer cells don't preferentially use oxygen to break down fatty acids to produce the most amount of energy using oxygen and our densest energy source, which is fatty acids. Instead, cancer cells tend to prefer glycolysis, using glucose to quickly make energy, but it's actually less efficient in terms of the amount that it can produce. So that's number one. The second piece is that some chemotherapies tend to worsen insulin resistance because they directly act on the insulin receptor pathway. So the ketogenic diet kind of exploits both of those ideas. With a ketogenic diet, you're consuming very few carbohydrates, and so the body essentially starves out the cancer cells. The second piece is that if you are not consuming any carbohydrates, you're not going to have to worry as much about the insulin resistance and the effect that it can have on raising insulin levels and the theoretical worsening of cancer from those elevated insulin levels. Unfortunately, the Warburg effect isn't perfect in terms of some cancer cells actually do run on things besides glycolysis. However, that still hasn't completely overshadowed the research that has found some folks actually do better on a ketogenic diet when going through chemotherapy. This is for a few reasons. One, it tends to sensitize the cancer cells to that chemo, so it makes them more vulnerable, making any sort of treatment more effective. And then two, it tends to reduce some of the side effects of chemo in the person. So it, improves cancer sensitivity to it and then reduces your sensitivity to it. And as a result, tend to do better. Other studies have shown some potential benefits for reduced fatigue, preserving muscle mass. Some of the main ketones that we produce in a ketogenic diet have some muscle-sparing properties. And then also GI benefits, so less nausea, vomiting, and diarrhea. Now, this is not slam dunk enough to recommend that everybody use a ketogenic diet during cancer therapies. However, if you're able to tolerate the diet, the biggest concerns usually are going to be raising your cholesterol because of the usually higher amounts of saturated fat that we're consuming, and saturated fat can directly increase LDL cholesterol levels due to its effect on the liver. Not really a big issue if you're doing a 6-week, 8-week, 2-month prehabilitation program. So it's worth a try for some. But if you're not able to tolerate it, again, don't beat yourself up. Do whatever you can. The name of the game here is just give it your all, whatever all might be. Why aren't these ketogenic diets standard of care? Well, the research on them is not conclusive. Most of the studies are quite small, usually under about 50 participants. Many often lack the appropriate controls or randomization, so we can't confidently say that there weren't other factors playing a role in different outcomes. Patient adherence to the strict rules of a ketogenic diet can be difficult, and so can't say for certain that there weren't other factors that the patients themselves were doing, such as going off of the ketogenic diet at times. Also, different cancers respond differently, so it makes it really hard to generalize findings from one study to other populations. There also may theoretically be some negative interactions with specific chemotherapies, particularly if patients tend to underconsume the appropriate electrolytes when on a ketogenic diet. There's the idea of the keto flu. So when folks go from a normal diet to a ketogenic diet, oftentimes they have some discomfort, feel quite run down, flu-like symptoms, hence the nickname there. And that's the last thing you really need during prehab when you're just trying to maximize your kind of productive time here. But if you're going to try and do that during your therapy, initiating it during your prehab program is probably the right time to do it because you aren't going to be, augmenting any sort of negative chemotherapy side effects at that time. So if you can adjust to it ahead of time, that would be beneficial. Roughly, I'd say that the folks who may want to consider this the most, and again, absolutely discuss this with your team and your dietitian and anybody else who's going to be working with you on this cancer journey. Chemotherapies that may notoriously worsen insulin resistance, or cancers that tends to be related to metabolic disease. So if they're related to metabolic disease, theoretically, they may have more of an insulin responsiveness. And so by depriving them of that stimulation, you may potentially improve your outcomes that way. Some of the chemotherapies that may worsen diabetes or insulin resistance leading to diabetes or prediabetes would be medications like 5-fluorouracil, 5-FU, when taken orally, not topically for skin cancer, asparaginase, certain platinum-based medications like cisplatin or carboplatin, anthracyclines, so it's like doxorubicin, steroids, of course, cause elevated blood sugars. And those are often given in the cases where there might be some sort of swelling. So if you're getting radiation for a brain tumor, things like that. PI3 kinase inhibitors. So PI3 kinase is one of the enzymes in that insulin receptor pathway. And so if you're inhibiting that, you're going to, by definition, worsen insulin resistance. And then anything that's going to affect mTOR. So that list isn't exhaustive. And if you're really interested in doing something like this, again, speak with your oncologist, speak with any sort of cancer nutritionist, dietitian, something like that. Or once you get a list of your treatment plan, then just start Googling around and seeing which of those may have some sort of a metabolic side effect. And so it's really, really important, of course, before you start doing anything that can have a major metabolic electrolyte impact, to speak with your team. Because if you switch to a ketogenic diet, as I started saying before, not only is that keto flu a thing, and so the symptoms are going to be terrible, but you also might actually have an issue with the electrolyte changes that happen. So if that is one factor, and then your chemotherapy may affect your kidneys or something else, and then all of a sudden your electrolytes get even worse, then that can only compound the issue. And we don't want anything like a fatal arrhythmia or just muscle cramps or anything that can happen because of this stuff. So it's really not worth causing more trouble for yourself just at trying to get some incremental benefit here, if that is a potential. A lot of prehab is potentially getting extra inches with no real expense. Exercise, besides making you a little tired and some soreness, really isn't going to have any sort of negative outcomes. And so that's why it's worth trying different kinds of exercise and finding what works for you. When it comes to something like, very exotic nutrition plans that can actually cause discomfort, if not worse, that's when it's not such a simple recommendation.
Get your sleep.
Get your sleep.
Take care of yourself.
Take care of yourself.
Sleep is really important. You're going to get the most out of your prehab program. Besides avoiding looking like this, it'll make sure that you're recovering better from exercise, controlling pain better, optimizing your mood, and really recovering the best that you can. Pain gets better with sleep, mood gets better with sleep. Fortunately, exercise is also good for your sleep quality. So, how else can you optimize it? First, make sure you're in a cold, dark room. Typically, I shoot for around 64 degrees, 65 degrees. You don't want to be too cold where you're uncomfortable, but you really want to make sure your core temperature can drop in the middle of the night there. That'll help you get in that deep sleep phase. You want to make sure that your going to bedtime and wake up time is consistent. The brain kind of prefers that rhythm there. When it can predict when you're going to go to sleep, it makes it easier to fall asleep then. When you jump around times, not quite as easy to fall asleep when you need to. If you're going to go to bed late one night, keep the same wake up time. It'll hurt the next day, but that next night you'll fall asleep like you should. Maybe sleep in, that might affect your sleep tomorrow. Beyond that, some supplements can help too. Melatonin, of course, is one of the best known ones. I keep it no more than 5 milligrams, and ideally you want to find a time release so that it mirrors what normally is going on in the brain. Other supplements like magnesium, I shoot for something like glycinate or threonate because those are better absorbed and cause less GI side effects like diarrhea. Ashwagandha is commonly used. Taking that one, about 600 milligrams, can be quite effective. Collagen. So the beauty of this one is collagen is made up of a couple different amino acids, one of which is glycine. Glycine tends to help with sleep quality and may improve blood sugar control. So taking a good 3 to 5 grams before bedtime may help that too. Another supplement that has a little less research, but again, kind of one of those risk benefits where it doesn't seem to be much risk here, is phosphatidylserine. That one may reduce the output of stress hormones from the adrenal glands, which might get you some better sleep if you're tending to be stressed and ruminating all night. When it comes to medications, this is where things get a little dicey. I'm not a big fan of the Z drugs like Ambien, Lunesta, and those, because the sleep doesn't tend to be sleep so much as unconscious. Instead, I usually use something off-label, like a trazodone, gabapentin or Lyrica, pregabalin, baclofen. If you're having nausea or poor appetite, Remeron can be helpful there too. In that same vein, plus a little bit of pain, maybe doxepin or nortriptyline, at low doses, those can be quite effective. Higher doses, there may be some side effects to worry about. In the end, cognitive behavioral therapy for insomnia, CBTI, tends to be the most effective treatment for chronic insomnia. So if it's been bothering you for a while, I'd suggest reaching out and getting a professional to help you with that one. One other piece, those over-the-counter antihistamines, Unisom, ZQuil, all them, they may help you fall asleep. They do impact your actual sleep architecture by affecting your REM sleep, but at the same time, in the short term, probably not a big deal. Though in the long term, it may actually cause some sort of cognitive issues. Recent studies have shown that one. So I wouldn't take it for the long term, but here and there, better than no sleep at all.
Okay, so the next piece we're going to discuss relates more towards the neuropsychiatric and psychological aspect of the prehabilitation pillars. So in terms of the timeline here, you're probably the next section of what we're going to discuss, concepts there relate to right around when you first get diagnosed, and you may be well past that point, but it's also not a linear process either. So following a cancer diagnosis, you have a grieving process like anything else. The life that you knew before, kind of blissfully unaware of the potential for cancer, is now gone. But like any sort of grieving process, you're in the woods, there's a way out. So understanding kind of what to expect along the way, and also understanding that it's not a linear process and you may swing back to earlier stages of this whole process, will normalize and permit you to feel these feelings and understand that it's okay. It's a normal part of the process and that there's no wrong way to do this sort of thing. So some of the normal responses and normal kind of reactions to a cancer diagnosis will be shock and disbelief. This phase, you may not even honestly believe that it's a real diagnosis. Oh, is a error on the lab test, or these symptoms X, Y, and Z. That's because of this other thing I've had for years. Those are normal responses, and in this case, when there's certainty in the diagnosis, which after something like a biopsy or professional opinion and interpreting the data, once you're at that point, being able to move through this phase lets you get to the preparation and the treatment sooner. It lets you invest that time into prehab and preparation and taking control of everything. So like everything else in prehabilitation, no shame if it takes you some time to get through this and process it and accept it. But the only way out is through, and the sooner you get through this, the better opportunity you have for making the most of the next stages that come in terms of treatment preparation. Another common response, fear and anxiety. This one is pretty understandable. There's a lot of unknown here, and that's what we're trying to break through with this kind of programming, is to make some of that unknown known, shine a light on it, get a better understanding of everything, bird's eye view, lay of the land, every other kind of possible metaphor here. Just because the more you know about it, the less general anxiety and unidentified fear here can hold you down. Then comes the sadness and depression. You're grieving the life that you lost. You're coming to terms with the potential for negative prognoses or just a permanent change in lifestyle. But this part of the process in particular is where you really want to be involving someone along the social work or psychology or psychiatry continuum here, just to be able to process in a controlled setting and take advantage of the time you have when you have it, in terms of
preparation and treatment, everything like that. Anger. Anger comes next. There's actually no real order these have to appear in, but anger is a common response because suddenly you have this loss of control. Loss of control is another section here. You have this loss of control. You have this forced change in identity. You have this perceived unfairness, or you may not consciously be doing this, but there's going to be a focus on certain areas where maybe the ball was dropped, or some delay in diagnosis, or some symptom you noticed years ago that turns out it may have been related. All these things. Anger. It's a way of regaining some control here by being able to channel the powerlessness feeling of the new diagnosis and point that at someone or something. Guilt and stigma. I mentioned this a few times so far, but many cancers have some association with lifestyle choices, and as a result, we carry a lot of guilt and stigma with some of these. The study I refer to often identified that folks with lung cancer, even if it's not associated with smoking, carry that stigma just because of what they think other people are thinking about their diagnosis. In reality, like all kinds of maladaptive behavior, there's no benefit to having this kind of perceived stigma and everything. Really, the sooner we can get through this, the better. But it goes back to all the poor choices in our life we might have made. All they do is tee up a potential opportunity for something like this to happen. But in the end, it's bad luck. It's a random mutation. It's these sorts of things that are out of our control that end up lighting the match and converting any sort of elevated risk into an actual cancer development. So, and the last one is this loss of control. Now, this is a psychological concept I had looked into a lot when I was doing research on burnout. And lack of control over your own environment is a very quick way to have this unsettled, uncomfortable, frustrated sort of perspective on things that are going to affect all the outcomes afterwards. So part of the therapy sessions will involve regaining a sense of control. That's also why I'm such a champion of prehabilitation, is it's one way of regaining that control, taking control of the steering wheel here and determining some of the direction of the outcomes here. So there's a couple identified psychological distress factors that may impact your treatment outcomes. I'm going to list these off, go less into detail because they're pretty self-explanatory, but there are different kind of strategic points that you can target to juice the next steps and the investment in the next steps. It'll make sense once I go into some of these. Treatment adherence. So distress may affect your ability to stick with treatments. So being able to find ways of determining what area of distress, whether it's painful distress, going into it later, general psychological distress, what's holding you back the most. And that's probably the place to invest more of your attention to remove that anchor from your progress here. Physical recovery. So in this case, when you're having psychological distress, stress hormones will then impair your recovery. Cortisol, poor sleep, all these things will directly or indirectly affect your recovery from both prehab, so exercise aspects, from treatments, as well as your ability to just fight cancer in general. Pain perception. So pain is going to raise those stress hormones, but also just sap your interest in being able to do treatments. This is why adequate pain control and vocalizing the amount and source of your pain to your prehab team early can pay dividends later in both being able to control the pain and all the secondary biochemical and just general wellness type effects it can have. Fatigue management. So there's cancer-related fatigue, which is from the inflammatory aspect of cancer itself, as well as the treatment-induced fatigue from chemotherapy, radiation, whatever. These will all kind of sap your energy reserves. So being vocal about this as well and finding ways to strike when the iron's hot. So say you have the most energy at 2 p.m. in the afternoon because you're able to sleep in, recover as much as possible and recharge the battery, then prioritize all your heavy lifting, literally and figuratively, for that time period. So build your schedule around when you notice that your circadian rhythm of energy here is at its peak. Quality of life. So just general anxiety and psychological distress is going to affect your quality of life, obviously. And I say it sort of sarcastically because it's not very insightful of me to say something like that because it's kind of obvious. But being able to relieve your psychological distress as much as possible so you can enjoy your current time and just be present in the moment, that's really important for, the life and the years, not the years in the life kind of thing. And finally, survival outcomes. All those things we just listed will impact your survival outcomes. Being able to recover and adhere to treatment protocols and, fatigue in general, all these things will generally have direct or indirect impacts on overall survival. So if you're able to tolerate treatment and stick with it better and recover better and all these things, you're likely going to have better outcomes on the survivorship side of things too. So this is why, even though it might subtract time from some other more, treatment-related strategy, whether it be physical therapy or something else like that, in this case, it's still very important to prioritize psychological wellness, especially early, so you get the rest of the benefits as you go on. And this is something we talk about in other areas of prehab as well, just that focusing on your overall mental state is huge for getting the most out of all the physical type stuff that you're going to be doing. So medical school and other medical training programs, we learn the mnemonic SIGI caps to identify different symptoms of depression. These are by no means fully comprehensive, but can make it a lot easier to realize that what someone is demonstrating might be true kind of clinical diagnosable depression here, and not just, you woke up and having a bad day kind of thing. And by identifying something as well documented as comprehensive depressive symptoms means that you're more likely to respond well to treatment and get the most out of it kind of thing. So what this stands for, SIGI caps right here, is going to be sleep. So the first S is for sleep, and that's going to mean either both insomnia or hypersomnia, so not able to sleep or sleeping too much. I is interest, so loss of interest in prior hobbies and things you enjoyed doing. Guilt is a very common one here. But feelings of guilt, both for, things that may have some kernel truth here or things that don't make any sense to feel guilty about. Low self-esteem kind of falls in there too. Energy. So just general kind of mental and physical fatigue. And I think you're also probably starting to realize too that there's a lot of overlap between symptoms of clinical depression as other more physical symptoms here, say of testosterone deficiency overlaps a lot with this, or just the effects of inflammatory state related to cancer or other hormonal things. So it's important to, once you identify this, quickly look into other potential medical areas that could be contributing to these sort of symptoms, because if you can treat the medical contribution, you may relieve a lot of these symptoms and no longer feel clinically depressed and just be able to more quickly move into whatever next phase of treatment there is for prehab. All right, so that's SIG-E. C, concentration, so difficulty concentrating, indecisiveness, easy distractibility, memory issues, those things fall under that concentration. Appetite, so either increased or decreased. So if suddenly you have no appetite, or suddenly you're constantly eating and hungry and things like that, even if it's more of a unconscious, just nibbling constantly, those are both symptoms of depression as well. P stands for psychomotor. So this is going to be either restlessness, agitation, difficulty just kind of sitting still. You're just constantly fidgeting and just this kind of internal drive to move without even making it kind of a conscious decision. The last letter in this one, S in Diggy caps, is going to be suicidality. So any thoughts of self-harm, plans, behaviors, sometimes it can be more of a obsessive kind of intrusive thoughts, versus other times it may be more of a intent-based, I feel so low that the only way out is out. If you're at this point, understand that those feelings don't necessarily last. And with treatment, you'll look back at those moments and say, I'm so glad that something horrible didn't happen here, that my depression didn't get so bad that it took my life from me, kind of thing. So this is an area where I think we can't exactly cover it in a brief YouTube video. But if you're at that point, call this number or this number. There are many help agencies and helplines to stop something in its tracks and get you the longer term investment of professional help that you need to get out of that emotional hole. So otherwise, these are all the symptoms here of depression that kind of fit in a neat box. There are other aspects of this one that would be getting too far out of my wheelhouse. But basically, once you start seeing a number of these boxes checked here, it's worth particularly investing in some professional help and taking the time to do that, because feeling well is really, really important for being able to proceed through the next treatment, preparation, all that stuff. Okay, so then kind of further back on the spectrum in terms of mood issues, anxiety, is general stress management. So preventing getting deep in the hole here in terms of low and worsening mood is maintaining control of life and finding good outlets for stress and stressful situations and things like that. So mine has always been exercise, hence why I've stayed in pretty decent shape. Oh, that's a positive thing there. Bad sign. Either way, it doesn't mean it has to be yours. So really kind of the ideal way of getting an outlet and catharsis here for a hobby that may improve mental wellness is try and find something that gets you that flow state. Everyone has been in this flow state at some point in their lives, but really what it involves is getting so focused on a task that time passes you by and you almost get a little bit of a euphoria almost because of how much you get into something. Our brains are wired for this, and tapping into that is a great way to blow off stress, really be mindful and present in the moment, and all of a sudden, all those annoying nagging things from the daytime, silenced. You're in your own little world, your own little bubble here. It's a great way to tune out some of the noise. So some tasks like this could be, woodworking, web development, bonsai, gardening, really whatever. Once I got in this flow state, and I used to be really into kind of small relief carvings and woodworking, that kind of stuff. And I was deep in this flow state on a Sunday night until suddenly I snapped out of it when I found that I lodged an 11 blade in my thumb here. Had to go to the emergency room. So I'd pick a safe flow state for now, because the last thing you want to do is end up getting your thumb stitched back together on a 8 p.m. on a Sunday night. But, to each his own. All right. So here's what to look for when trying to find something that gets you in that flow state. You need to care about the task at hand. So for me, I'm not a big knitting kind of person. In this case, that's going to be tough for me to get in the flow state, but really, as long as you're mentally invested in it and it requires some attention, it is possible. The activity or job or whatever it is cannot be too easy, and it can't be too hard. You can't be getting frustrated, but you also can't be kind of just going through the motions and let muscle memory take over. You need to have a demand for your attention here. Also helps if you're good at it. So this is why the beginning of a new hobby may not get in that flow state as easily, but once you're starting to get some kind of personal prowess here and really back to the woodworking thing, once they're starting to get nice kind of ability to take the picture in my head and put it onto this relief carving here, or wood burning I was doing too, that's when I started noticing that my Sunday nights went from 5 p.m. to 10 p.m. in a blink, and all of a sudden I had wood shavings all over my living room carpet, and my very patient wife said, time to clean up. And the final piece here, you want your mindset to not be about the destination. It's not about the end product. It's about getting there. And if you're hyper-focused on, I want to get done with this thing, you're not going to get into that flow state. You're going to be constantly looking at your watch or wondering what's taking so long, getting frustrated. If it's more about the enjoyment of the activity, then you're much more likely to get lost in it. So it's difficult to see the red light flashing when you're slowly progressing through symptoms here. So to mix metaphors, frog in the boiling water, you can tolerate a lot of things if you get there gradually without realizing that's a really big problem. So here are some signs that it's time to get some help. First one being, your daily function has been persistently affected for over 2 weeks. At that point, it's not just a funk that you're going to snap out of. Get someone to lend a hand and pull you out of the whole thing. At any point of safety concerns, whether it be for yourself or for somebody else, self-harm, losing the ability to care for yourself. Your mood is so low that you're unable to bathe, feed, etc. adequately. Reach out and get some help. If you have that significant change in sleep, energy, mood, appetite, the Siggy CAPS criteria, it's something you're noticing that those boxes are getting checked a lot more easily, then sign that it's time for grab some help. If you start withdrawing from relationships or activities that you enjoyed previously, so you really used to enjoy your Tuesday night bowling nights and all of a sudden you can't be bothered to go, or all of a sudden your Pelotons now become a hamper for your dirty clothes or whatever, signs to grab some help. Get back to the life you enjoy. If there's any introduction of substances to cope, whether it be alcohol or other substances, clearly a sign for help, because at that point, those tend to be kind of self-defeating and you end up getting yourself deeper into the hole, not pulling yourself out of it. And intrusive thoughts, anxiety, panic attacks, these things. You don't need to live like that. There are ways of treating these things. And the sooner you get that treatment, the less of a self-fulfilling prophecy some of those anxiety attacks become. Thank you sincerely for hanging with me through all those details. Again, please like and subscribe so others can find this resource during their cancer journey. If not already, the next video should be up within a week, and that one will be covering balancing cancer and life. So some tips to keep working on your terms while you're fighting and recovering.